like an oasis sprouting forth from lush greenery in virgin lands in the ancient and culture-rich town of Ila-Orangun, Osun State, in the southwest Nigeria, sits a citadel of excellence, a testament to ingenuity and a veritable and secure assurance for the future. This vast, unending oasis of knowledge is the 2-year-old Federal University of Health Sciences, Ila-Orangun, with its permanent site sitting and sprawling on 530 hectares of land donated by the Osun State government for this purpose. The landmass on which university permanent site is located was part of the land acquired way back in 1979 for the establishment of the famous College of Education, Ila-Orangun, a brainchild of the Muhammadu Buhari administration. The Federal University of Health Sciences, Ila-Orangun, was established in 2021 as a specialized tertiary health institution in direct response to the devastating COVID-19 epidemic, which stretched the nation's health facilities and resources to the limit. COVID-19 was an eye-opener to the government on what was lacking in the nation's health sector and tertiary healthcare system, and the dire need to train specialized personnel to meet up with future challenges. The institution also has a mandate to turn out professionals that would offer world-class multi-pronged healthcare services to the populace, reverse the trend of overseas medical tourism, and train efficient health manpower for Nigeria. Professor Akin Olawale Lasisi is the university's pioneer vice-chancellor.
The mission statement is to be a world-class institution and delivering healthcare facility to the populace, and also to reverse the medical tourism back to Nigeria. In terms of our facility, the mandate is to train healthcare manpower for Nigeria. That means doctors, nurses, laboratory scientists, pharmacists, and so on and so forth. This university was established in 2021 by President Muhammadu Buhari, and I was announced as the pioneer vice chancellor, and I received my letter of appointment on the 18th February 2022. So we can say effectively this university took off from 18th February 2022. So the first thing will be to even chart a way for the future of the university. And that means we have to, at that time, we had to write the academic brief of the university and do the master plan. After we have received our letter, myself and 3 other principal officers, that's the boss, librarian, and the registrar.
Professor Lasisi was appointed pioneer vice-chancellor in February 2022, alongside 3 other principal officers, namely the university registrar, the librarian, and the bursar. The new university administration was quick to dig in and draw up a realistic, ambitious, and implementable working master plan for the university to achieve its lofty vision. The startup financial boost came from a whopping Takeoff grant of 5 billion naira approved by the Buhari administration through TED Fund. With this substantial Takeoff grant, the university developed its temporary facilities with 5 buildings housing the College of Education, the administrative office, faculties, laboratories, lecture halls, and offices, among others. Funds from the Takeoff grant also went into the building of the University Health Center, the library, the Faculty of Basic Medical Sciences, and the teaching hospital.
Funding to Takeoff was, we got the intervention from the TED Fund. The President Muhammad Buhari, as at that time, had arranged about 5 billion with the Tertiary Education Trust Fund, which was our Takeoff grant. From that, we developed the temporary facility we were given. The temporary facilities we were given included 5 buildings in the College of Education. So those were the buildings we remodeled into administrative office, and then the faculties, which included the laboratories, the lecture halls, office for staff, the library, the Earth Center. We remodeled out of this building, and that took some part of the Takeoff grant.
The building of the teaching hospital was particularly an ambitious project of the university authorities, who saw the need to solve an urgent, immediate, and future need of the institution.
The teaching hospital we had to do because one is a University of Medical Sciences, so we believe that the biggest laboratory that the University of Health Sciences will need will be the teaching hospital. So, because it is unconventional for universities to build teaching hospital, and like even the Federal Ministry of Health said when they visited the place, they've never seen that before, that a university would build a teaching hospital. But I just thought that there's no other way to go. There's just no other way to go. A teaching hospital is central to our training in all parameters: medicine, medical students, nursing students, medical laboratory science, anything you talk about, physiotherapy, a teaching hospital is just central. So we had to go the whole hog. Is something I believe very strongly we had to do. One, I look at the future of the university. If you don't build a teaching hospital now, it will always be a problem that will need to be solved. Number two, where are our students going to get trained? All the teaching hospitals around us, all the general hospitals around us, they have one university or the other using them for training of students. So, you can think of Ife, you can think of Oshogbo, you can think of Ekiti, you can think of Ila-Orangun. All these people have their own teaching hospital. They have their own medical students quota, which the MDCN had certified, beyond which they can't go. So, what will happen to the future of us? That's why we had to go the whole org, and it is like a belief, and we had to just summon the courage and the determination to do it, and that was what we did.
The university's massive Faculty of Basic Medical Sciences, when completed this semester, is expected to host both the Faculty of Basic Medical Sciences and the Faculty of Allied Sciences. Funding for the university has also been coming from other sources. The now completed University Health Center was funded by the Sustainable Development Goals Office and the Presidency. The university has also benefited from project funding interventions by the Federal Ministry of Works, the Rural Electrification Board, as well as from the 2024 budget appropriation. The University Teaching Hospital project, which has been assented to by President Bola Tinubu following an inspection visit by officials of the Federal Ministry of Health, is now 98% completed. Students of the Federal University of Health Sciences, Ila-Orangun, are very much elated And one of the reasons for this is that they now have a place to train for clinicals
with cadavers
available for practical anatomy.
Faculty of Basic Clinical Sciences. One, it will serve medicine, and also it will also serve other medical sciences, serve pharmacology and things like that. And then it was a big faculty. If you see it, you're going to see by the takeoff, when they finished, they finished now. By sometimes this semester, we're going to move into it. The plan is that because of its size, we're going to divide it into two and get the Faculty of Basic Medical Sciences to use a part, and then the Faculty of Allied Health Sciences to use a part. And we feel, and I have no doubt that it will be adequate for us for a start until then we start adding the other infrastructures. So those were the two things we committed the takeoff grant to. But we know that, but I know, and you know, that to fund infrastructure development in a university cannot come only from TED Fund. It will come from from as many, you will get your interventions from as many parastatal as you can think of. So the first building to be completed in this university is the University Health Science. Is our University Health Services, which is the health center that will serve the staff and the students who are ill. And we got that intervention from the Office of Presidency, the Sustainable Development Program. And so it was more like a donation to us.
The university also benefited from the 2023 budget appropriation, which enabled the building of the University Gate and a multidisciplinary research laboratory. There is also the College of Medicine, Phase 1, which will serve as Faculty of Basic Clinical Sciences. Another intervention from TED Fund facilitated the building of the library and Senate building. The Senate building is about 90% completed, and besides this, virtually all the university's courses can boast of a laboratory, including the majors, that is, physics, chemistry, and biology laboratories, which were all included in the TED Fund Takeoff grant.
The statutory department of the university is shadowed with the responsibility of handling the infrastructural development of the university, planning physical works, and managing facilities for the comfort of students, staff, and other visitors of the university. Our work, like you said, has been a very serious one, a very tedious, because we are the ones starting the university. And you know, it starts with planning for physical infrastructures. As soon as the university is being established, the first set of people that come into action, one of the departments is works and physical planning. Essentially, we are in charge of services that will create comfort for not only the students, like I said, for staff members, and of course, anybody that is coming into the university.
When you go around, you'll be amazed that university of this time, barely 2 years, we now have a teaching hospital built simultaneously with the university. So the teaching hospital is there now. So we are in the process of recruiting the chief medical director and all the other doctors. Hardly we use here anywhere in the whole country where the university and the teaching hospital are being built simultaneously. And that has been done here. If you see the facilities now, we are ready to take in patients and we are ready to get doctors. So it's a twin facility, the university and the teaching hospital at the same, less than 3 years. In fact, you'll be surprised that something like that can be done in a country like us, where most of the time you spend the effort of a mile to move a yard. So when you see that, and if you move within the campus, You see the Senate building is already there. The library is there. Laboratories are there. They are putting up the College of Health Sciences building. Medical students hostel also. They are doing everything pari passu. So in terms of what we have on ground, I think it's tremendous for a young institution like this.
The Federal University of Health Sciences Ila-Orangun at Takeoff requested the National Universities Commission to accredit 9 courses. Today, the university has successfully secured accreditation for more courses, making a total of 13 courses now being run at the institution. A total of 528 were matriculated as pioneer students for the 2022-2023 session, although the university was not originally listed on the JAMB brochure due to the fact that UTME examinations had already been conducted at the time of the pioneer admissions.
I have to use this opportunity to appreciate the management of this university and the federal government in particular for providing the fund. When you are talking about the laboratories, there are some basic things that is the essential things in the lab. A laboratory must have electricity.
The university's advertorial offer requesting interested candidates to make a change of institution on the portal received overwhelming response, with a challenging 6,505 signifying interest to study at the Federal University of Health Sciences, Ila-Orangun. Now, this figure was proned down after a rigorous, diligent and painstaking process to select the very best, including sitting for the university's post-UTME exams. The university today has a total of 1,300 students after admitting 800 more due to the successful accreditation of 4 more courses. For this year's admissions, 3,799 candidates have already applied and still counting.
We've been having good lecturers. That's what the management have been providing for us. We have lecturers and doctors that take our classes for us. And being a new university, we have students, and the classes are not choky, so they have time to take us and interact with the students. So it is more or less like a teaching, and we've been taking our classes, and we hope and we see that with the way things are going, we tend to have good students.
The relationship between student and management is fair enough in the terms of there have been good communication between the students and the management, because wherever the students have any issue or anything, they come to us, and we tender their messages to the school management, and the school management has also been good because they answer all and they make sure we are comfortable.
Presently, what we have is SRC, Student Representative Council. We have the student that is in charge, and we also have the vice Student Representative Council. Those are the people that serve as let me say, intermediary between the students and the university management. So if there is anything we want to pass to them, we inform these people and they disseminate the information to them.
The University Registrar Kazim Kayode Babamale speaks more on course accreditation, available courses, pioneer admissions, and the current admission situation.
We started with 9 programs in the 2022-2023 academic session, and we have also gone ahead to get additional approval for 4 programs in the 2023-2024 academic session. We now have approval to run physiotherapy, prosthetics and orthotics, environmental health science, biotechnology, and molecular biology. When we started in the year 2022-2023 session, the total number of applicants who signified interest in coming to Federal University of Health Sciences Ila-Orangun was 6,505 students. In fact, that was, will I say that was the most challenging admission exercise we did. We started with very hot, because then we only had approval to take 500 students. And we had 6,505 applicants. So it was really, really tough. We had to crack our brains, strategize to make sure that we select the best 500 out of the 6,500 applicants that applied. So at the end of the day, because of the admission policy, attrition rate, when you consider attrition rate, when you consider, we requested for a waiver, additional waiver from JAM to make sure, because the competition was tough. We ended up admitting 633. But by the time we did our matriculation exercise, only 528 actually turned up and matriculated.
I want to tell you, we are conscious of the environment we have. Before we fixed we call these student charges. We don't charge fees here. We comb around the state, because we have about, around here, we have about 6 universities. So when we got there, we look at what they were doing. So we compare this one and we fix our own fee. Our fee, sorry, not fee now, I want to say our student charges are very, very comparable with the ones around us here. So our one is not the smallest, it's not the biggest.
Right from admission, the criteria for admitting students here is stringent than many universities in the country. It is tailored towards University of Ibadan, OAU, and University of Lagos, because the entry requirement is, and just for anybody that is within the system, is all the credits must be in one sitting. Right from the beginning, we've weeded weak students. So we don't have weak students, unlike other universities where they can just take maybe less than 50 as aggregate. Here, any student that got an aggregate of less than 50 will not be given admission.
The function of this unit is to coordinate resource verification, because some of these programs, they have their regulatory bodies, like the nursing science, medical lab science, prosthetics and orthotics, physiotherapy, and the likes. So the main function of the unit is to coordinate resource verification by the council or their regulatory bodies, and also coordinate NUC accreditation, NUC resource verification. We've done NUC resource verification, but we are awaiting NUC accreditation. So any issue related to curriculum is being handled by this unit. That is when after consideration at the departmental level, at the faculty level, the curriculum will be forwarded to the curriculum committee, academic planning and curriculum committee, and being approved by the Senate. So the major function of this unit revolves around academic issue.
In this university, Faculty of Science serves as a service department. All the Part 1 students that come in, they must come to Faculty of Science to start with to take year 1 courses, chemistry, physics, biology, both semesters. So that one is in place, in addition to our students in Faculty of Science in 3 departments. We are actually hoping that in the next few years we incorporate new programs like medical physics, medicinal chemistries, and so on and so forth, so that we can actually key into the vision of the university, which will train people in the area of health delivery.
What we are currently doing as the student of the basic medical science, there are some other courses that we introduced. We have a basic medical science, which is life-saving techniques for all the students in the university, either than Faculty of Basic Medical Sciences, Allied Sciences, or Faculty of Sciences, so that in case of emergency, they can be very responsive.
The university library is a critical and strategic resource for the young institution. It is a hub designed to support the university's vision and mission statement, especially in the area of research, teaching, and community service. The Federal University of Health Sciences Library at Ila-Orangun is a world-class 21st century library that acquires resources needed for research and has lived up to its billing since coming into existence fully in 2022-2023. The library is well stocked with books, electronic and print, journals, and also subscribes to some databases useful to the students and lecturers. Password-based internet access is guaranteed for staff and students such that they can access the library and use its resources from any location. The library is automated with its stock available online to database. Buki Olufemi Ashobiojo is a university librarian.
To let you know that the library is one of the most used, spaces in the university, in the sense that we have a dedicated generator, and so the students are happy. They know that whenever they are on campus, if there is no electricity anywhere else, if they are in the library, they will have electricity, charge their phone, see what we have, and use the library. And to make them friendly to the library, we have what we tag media, or what do we call it now, film hangout. So we show films to the students once in a month to make them relax, and they have been enjoying the environment that we provide in the library. I also want to stress the fact that in the permanent site, we are currently at the temporary site, but the permanent site of the university, the library, is completed. So the library building is also ready at the permanent site, and we are ready to move at any time to our permanent site.
Ashobiojo also said the university's library structure has been completed at the university permanent site. The university vice chancellor, Professor Akim Olawale Lasese, further reveals that the university has a 10-year academic plan, which includes the establishment of a faculty of pharmacy, a faculty of dentistry, and even a faculty of aviation medicine. He said the young university is already involved in research, noting that one of the university's scholars recently received an academic research grant award.
Our academic plan is a 10-year plan, and there are a number of things there, like there's Faculty of Pharmacy, which we have not started, there's Faculty of Dentistry, which we have not started, and at a later date, we're going to also add things like aviation medicine and things like that. But I mean, it's like asking a breastfeeding baby, when are you going to become an adult, and how will you become an adult? so that's it. So many things will be added over time, but all you need is at a time, we just make sure that we are putting our right leg in front and putting it solidly on ground so that we cannot be destabilized. So that's all I can say concerning that. But it's a University of Medicine, and we are hopeful that once our teaching hospital starts, we're going to bring in people who will contribute a lot to academic medicine.
For school, the nurses, for sciences, I think it's a so as for wearing. Or part of the code the commerce, ìyàwó sọ ẹ̀fẹ̀ sí ta warawara àtúngbà sí ta tẹ́tẹ́ tó wọn ta nísìn tí wàá wo àwọn ilé tá a kọ́ sílé tí àwọn àárín yẹn gbé ilé ti di ọtí kéèké là sílé tí wọ́n wálé nísìn nílà sí rẹ́ǹtì 2 rooms péré ẹ lè wà sí láàrin ọdún méjì wọ́n sì àwàrà ni àwọn èèyàn ń gbé nínú ilé wa wọ́n ti change pátápátá wọ́n yẹn ọlọ́jà sí ọjọ́ ọlọ́jà tà wọ́n ló ń jẹjẹ náà wọ́n ń dúró gan-an á lè kà fún tó lè dúró fún wọn.
Currently operating from its temporary site, the Federal University of Health Sciences, Ila-Orangun, has moved with the speed of lightning towards achieving the set goals of building thoroughbred and well-baked professionals to run and sustain the nation's health sector with world-class credible pedigree capable of holding out when compared with the very best standards in any part of the globe. This is the pact to which this great institution is duly dedicated and committed.